We were telling you a little bit yesterday about how the House seems to be swallowing a little bit of what the Senate is cooking up when it comes to this health care rework, and one that will keep some key taxes in place. I want you to take a peek at this. One of the plans that the Senate is cooking up calls for keeping those taxes, the 3.8% surtax on the upper income and that the 0.9% surtax for the upper income for Medicare in place. What do you think of that?
I do want to say this. We want to look at it in the context, Neil. Here's what we have on the back side of it. Even if you left that in as a potential pay for on the repeal and replacement, we've got tax reform on the back side of that. We know that lower taxes stimulate the economy.
So you'd be open to that as part of a means of getting to the tax thing?
Well, the devil is in the detail.
Understood.
I mean, our official position is to repeal all the taxes. At the same time, I want to make sure before I weigh in on anything that I look at both the trade-offs.
All right, now, an early senator who was looking at this not only got his way on getting the Senate Republican leader to keep the lights on and the doors open through at least the first half of August, but South Dakota Republican Senator Mike Rounds also appears to be open to that very idea of a 3.8% tax, largely on the upper income, that would stay in effect. In other words, not all the taxes associated with so-called Obamacare would be rescinded, but there is a method to that, not only to try to strike a deal eventually to get this thing done and out, but to move forward on a couple of things that would be advantageous. That opens up a lot of money, better than $230 billion worth over the next 10 years. You can do a lot with that, and doesn't Senator Mike Rounds know it? Senator, very good to have you, sir. Thank you.
Thanks. Appreciate the opportunity.
All right. So let's first talk about how you were able to influence Mitch McConnell to keep those lights on, to keep the doors open.
Well, there's a group of us. There were 10 of us that sent a letter to the leader. And we did it because we were pretty sure that the leader really did understand the need to stay in for a little bit longer. We've been in a series of delays here in the Senate, and if we could add 10 days to our work period, that means we can get some more stuff done. I think the leader wanted to do it, but this was our way of sending a very clear message that we would support him in this plan. And it's not popular to stay here. A lot of people want to get back in state. They want to be able to be back in their home states. But at the same time, folks that we're talking to, when we get back, we do parades, we do coffees and so forth. They tell us, look, we want results. And you may not have it perfect, but we want you to get something done. We didn't send you there just to keep the status quo. We sent you there to fix things. And if it means spending some more time here in the middle of August, I guess that's what we've got to do.
You know, the Rapid City Journal commentator there had said of you, Senator, when you looked at this and obviously got your way on keeping the lights on, but also on this surtax on the wealthy, to keep that going for a while. This idea apparently was among, you were the early converts to that Senator Rounds shows some welcome independence. I think I'm quoting that correctly. But, you know, conservatives in the House will come back at you, sir, and say anything the media likes, maybe we conservatives should not. What do you say to that, that they're concerned that you senators are giving up your zeal for tax cuts by keeping some big ones in place?
What we know is that there's a cost to Obamacare. We're not out of those costs yet. We have to recognize those costs, and if we don't take care of it and help the American public, they're going to end up with higher premiums, and they can't afford that right now. This is an Obamacare hangover, and we have to be able to help the American public deal with it. So what does that buy you, Senator? I know this means an extra $200 to $230 billion over 10 years. I'm not sure the exact figures if you keep that and the 0.9% Medicare surtax, again, largely on the wealthy. Does that buy you some more votes or potential votes among some of your colleagues, maybe yourself included, concerned about Medicaid cuts and the rest? More importantly than buying votes, what it does is it gives us some tools to continue some tax subsidies for folks who otherwise would have seen extremely high premiums because of what Obamacare put in place without any means to pay for it. And so what this does, it gives us one more tool to transition out of Obamacare. I know there's folks out there that like to see it just repealed, but if you do that, remember all of the protections that were in place through state laws and so forth were repealed by Obamacare. And if you simply repeal it and you don't address it with some changes and some market conduct reforms, then you basically have a no-frills plan in which pre-existing conditions could allow people to be dropped once again and so forth. And we want to take the best out of Obamacare because a lot of states had protections against the loss of pre-existing conditions before Obamacare ever came in. We want to take the best of that and incorporate it to make it a better product than what they've got today. And we think we can do that. But you've got to have the resources to transition out of Obamacare and back into a competitive market again.
Do you think that's what you'll have, though? I know your views on the subject, but your colleague, Rand Paul, has said this still ends up being, you know, Obamacare light. You've heard all the critics who, from largely conservative community, who say that when you compromise on these taxes, you're going to compromise on the next wave, that is the tax plan to come. For example, on the upper income, do you believe the upper income should get a tax cut?
I think everybody should get a tax cut, but I'd like to see it across the board. My proposal on tax cuts is different than reforming health care. We need to keep them separate. So in this particular case, we have a cost involved with Obamacare that we have to recognize. We have to transition out. And I respect Senator Paul. I understand that he would like to have this be as good as it can be. That's what we all want. But we also understand that if we were to simply cut Obamacare right now and walk away and say, there, we've repealed it, we're going to leave a whole lot of people out there that get hurt, that have no place to go to help take care of their health care needs. We can't do that.